week. It's going really well. Today I want to talk about something called projective identification. And the reason I want to talk about this is because a lot of the guests come down here and they're overwhelmed with a ton of emotion. And they're confused as to like what's going on for themselves. Because, you know, they all have normal lives. They have struggles like everybody else. There's conflicts going on. There's also really amazing, happy things and happy times. There's just a whole sort of, you know, lifestyle vibe that happens for all the guests that come that is normal. But then there's this extra sort of added baggage that people are holding on to when they get down here. And what happens is, you know, for some of the people that I meet with them, and I sort of suss it out a little bit. What I'm sensing with a lot of the guests that come here is that they're holding on to projections of other people, because a lot of our guests have an empathic quality to them. They might not be full-blown empaths, which is a whole nother issue that I've talked about before in Facebook Lives, and I could talk about again. But they are definitely people that are loving and healing and want best for humanity and for their friends and family and people around them. They want the best for the world. So because of that sort of mindset, they're vulnerable to projection. So what does it mean to have somebody project onto you? This is what it means. So let's say I'm somebody that has some emotion that I can't really deal with. I have some hate or some anger or some sadness or some self-esteem issues. And I have like these extreme emotions that are very upsetting to me. And I don't have the tools to deal with them. I don't know how to do it. And I'm just overwhelmed and I'm confused and I feel upset. What I'll do is I'll look for somebody in my life that I can target. I'll look for somebody that I can project this onto. And then what I do is I identify that person, whether it's my therapist, my spouse, my partner, my friend, whoever. And then what I do is I project that emotion onto them. And I want to see that emotion in them, because then I can understand it myself a little bit better. So if I have anger, I project anger onto this person. Then I see that they're holding it for me. And then I can relax a little bit. I can just like, oh, take a break. Okay, I feel fine now. I'm not angry. But they're angry, right? And I can see it manifest in them. And what that does is it creates this weird dynamic between both of us. And the problem with that, and I need to leave this room because I got my son crying and he's upset. So I'm going to go into the back room, way in the back of the house, so I can actually have you guys not listen to a baby scream. So I apologize. Okay, so what is it about projective identification then that can burden us and make it so it's tough for us to really get the healing we need? Well, I'll tell you what it is. As a therapist, as somebody that worked with a lot of trauma and a lot of people with going, is that I hold on to a burden of people. I hold on to lots of anxiety. If I'm being projected onto, I'm being bombarded with anxiety, with all kinds of issues that are struggling. That looks like my internet connection is down. Okay. Costa Rica is not great. You guys are getting a tour of my house, right? Okay, now I'm back. All right, let's see if I can have a good connection here. Okay, so I'm going to liken the guests at Rythmia to myself and what I deal with in therapy. Okay, so what happens for me when I'm working with patients, right? And especially is that I'm having a lot of stress from a lot of people because I'm seeing all kinds of people going through a lot of stuff. So what happens is I'm just absorbing and receiving all this stuff all the time. And then several months of this, a year of this, a lifetime of this builds up and creates this dynamic within myself that I'm holding so much for so many people, and really upsetting, and it's hard to deal with. And it gets confusing about who I really am as a person. So if I'm being projected onto constantly by my patients or my family or my friends or my spouse or my staff, then I am holding all this emotion. And then when I come down to Rythmia and I do plant medicine, all of this stuff comes to the surface. Then what? Because I'm not aware that I'm holding all this stuff, it's really confusing. Because why do I have so much anxiety? I'm not an anxious person. Why do I have the tendencies to go towards, this behavior? It's not my natural way. I don't normally do that. And the reason is because it's this other vibe of projection that I've been holding on to and absorbing. So the reason I want to talk about this tonight is because I'm sensing this, and I'm seeing this a lot with our guests. They're very upset. They're very confused. They're very overwhelmed. They have a lot of emotion that have been holding, and they've been receiving this projection. It's called projective identification. And people around you feel safe with you, and they project onto you their own emotions because they think you can hold it for them. Now, any healthy, stable person does not feel that they can project onto you their emotions. So these are people that are going through a crisis, or they don't have the tools, or they're not sure about how, their own identity. And these are the people that will project. So a healthy person doesn't need to project anything onto anybody because they know it's theirs and they can deal with it. And this happens not only for individuals, this happens for organizations. If an organization is always demonized or people are criticizing it, well, there's two situations going on there. Well, maybe it is a bad organization, or maybe it's a really good one that's open to help people get better. And they're receiving a lot of projection from the outside environment because the people feel safe and they can project all of their pain and anger and stress onto this organization or onto an individual. That's what therapy is. So what I notice in the guests is that most of the guests are mini therapists. They don't know it, but they're doing therapy on all the people around them. And I often tell people as a joke, I say, well, you should be charging everybody a couple $100 an hour for this because you're acting as your therapist without getting paid, right? Because that's just your role in society. So the goal then is to have healthy boundaries and to not let people just bombard you. Because if you're getting bombarded and you're just holding all the people's pain and anxiety and depression and sadness and all this stuff you're holding, they're not getting better because they're just back to the square one and they're back to feeling sad again in a couple hours, and you're holding it for them and you're overwhelmed. It doesn't help anybody. The analogy I give, and I've told this to a lot of guests down here, is that if you're holding people's anxiety or pain or projection, really what you're doing is just catching them fish all the time. You have to teach them to catch fish for themselves. So that's the analogy. Don't just keep catching fish for everybody. You're going to burn out. You're going to get tired. You have to have them catch their own fish. So what does a therapist do? When they're receiving a projective identification, receiving a projection from a patient, they absorb it, they understand it, they interpret it, then they redirect it back to the patient in a healed manner. And that's what therapy is in a psychodynamic mind frame. That's like a theoretical sort of background of psychodynamic therapy. Back and forth, back and forth, back and forth. And that's what therapy can be depending on the strategy your therapist is using. But you guys in the community that aren't therapists, that are dealing with people back and forth, and receiving and absorbing this projection are getting burnt out. You guys are getting tired, you're getting burnt out, and you guys are at the end of your rope. So what that means is that when you come here, oftentimes you're confused. You see all this stuff surface in a plant medicine session and all this stuff surface in a breathwork session. Like, what is all this stuff? Well, I'll tell you, it's everybody else's projection that you've absorbed. So how do you reduce that? How do you minimize it? This is what you do. You stay plugged into who you are as a person. You don't allow projections when they're not appropriate. When are they appropriate? They're appropriate if you're actually working with someone in a healing career, or such as a therapist or a psychiatrist or a nurse or a firefighter or a counselor or somebody that's helping other people. That's when it's okay to absorb this, but you have to know it's not yours and redirect it. So that's one scenario. You can just kind of understand it's happening. Now, the other scenario is this: be plugged into yourself, be connected to yourself. Because if you're connected to yourself, you can't receive projection because you're not available. You're available to you. So if I walk into a strange environment with a bunch of people I don't know, I'm not going to be unplugged. I'm going to be connected to myself because I don't want to absorb everybody's deal, because it's not my job to absorb everybody's thing. So I want to stay grounded with myself and connected to me. Now, if I'm in a dangerous environment that's new, I'm definitely going to be unplugged and absorb because I want projection. I want to feel what's going on around me. I want to understand it, diagnose it. That's very important. Then once I get the lay of the land, I'm back to myself and I'm connected to me. How do I connect to myself? I just list how 4 or 5 emotions of how I'm feeling. I'm hungry, I'm sad, I'm tired, I'm happy, I'm excited, I'm nervous, whatever it is that I'm feeling for myself in that moment, I connect to it. Then I go and interact with people, or I go down a strange street that I've never been down, and I unplug a bit, and I know where I'm at, and so I can feel and absorb new things and different things. That's how I do it. And then when I'm done and I'm out of that situation, I'm plugged back into me. Okay, so projective identification is something that's happening all the time. It's basically human interaction. It depends on how much we receive versus how little, and how much we allow versus how much we don't. And a lot of the people that I see at Rythmia, like I said, are very empathic. They're very loving, and they're caregivers, and they want to help people, and they're very loving, nice individuals. So they're usually got a lot of this projection on them from their environment. And so what I want you guys to do to prepare to come to Rythmia is to recognize this, first of all, and then you can shed it and get it off of you. So when you get to Rythmia, you're already ready to deal with your own issues and not all this stuff that's been built up for 30, 40, 50 years that's not even you. It'd be ideal to get that stuff off of you beforehand, and then you can come and do the work and go deep. So come down to Rythmia, try out this program. You can get connected to yourself. You can release all this tension, all this projection you've absorbed over the years, and you can really get clear and have peace and feel grounded and focused. And I can also counsel you on how to do this. And you can learn how to receive projection and not receive it if you don't want to. So that's a little tip on how to get yourself clear and get ready for Rythmia and for all the program that we have offered. Thanks for watching, you guys. See you next Monday night. Pura vida.